Welcome back to In Focus. It's time for our Africa Health Network update. Health reporter Linord Moudou has been covering the International AIDS Conference this week, and she joins us now to tell us about a discussion she heard with a medical expert on the difficulties in fighting HIV/AIDS. Hello, Linord.
Hello, Vincent. Hello, everyone. While tackling the HIV/AIDS epidemic has been a challenging task for researchers and medical professionals over the years, the AIDS Conference is an opportunity for many to exchange ideas, share knowledge, and inform on new or improved scientific and medical discoveries to further the fight of the deadly but treatable virus. I sat down with Professor Quarrisha Abdool Karim, an infectious diseases epidemiologist, associate scientific director of the Center for the AIDS Program of Research in South Africa, CAPRISA, and the scientific co-chair of the 19th International AIDS Conference, and asked her analysis of the evolution of the science of HIV/AIDS over the years.
In science, there's a very incremental growth in knowledge. And as we meet today, that cumulative body of knowledge has reached a critical point where we can talk quite confidently about stopping the epidemic with all of the knowledge that has been accumulated. So that includes the information we have on how to treat AIDS. We have incredible options to almost eradicate transmission from infected mothers to infants, and then sexual transmission, which contributes quite a disproportionate burden to transmission of HIV, with the antiretrovirals for prevention and also for prevention for treatment, together with the medical male circumcision, the counseling and testing, condoms, male and female, behavior change, including for injecting drug users and harm reduction options. I would say we have what we need to stop the epidemic.
What is out there to help these populations that are said to be at risk?
Certainly, if you were a sex worker, today the options are much more than before. And, there was a time for sex workers where you really, firstly, you can't talk about abstinence, you can't talk about mutually monogamous relationships. So it really was male or female condoms. Male and female condoms have to be negotiated regardless of whether you're a sex worker or whoever you're having sex with. It's very obvious. The FDA approval of Truvada for PrEP use, I think, really opens an opportunity for a woman who is in sex work or a man who's in sex work, that these drugs taken before you have sex, daily dosing, can certainly provides an opportunity. With injecting drug users, there's increasing data that's provided at this conference and other meetings that clean needle exchange is important. The substitution therapy options. So those would be things that we would think about. So you asked about gaps. And I would say one of the biggest gaps we have is in reducing HIV infection in adolescents. And if you take the epidemic in the US, most of the infections are driven by new infections in young men under the age of 20. And then, there are other nuances there about Black and ethnic minorities that bear disproportionate burden. In fact, at this conference, there was important data presented demonstrating an incidence rate close to 8%. Now, that's what we see in Africa, in Southern Africa, and that's the sort of incidence rate you're seeing in the USA. So that's an important group. Again, PrEP offers options.
PrEP, when you mention PrEP, just to clarify, is treatment for prevention?
So there are two pieces about ARVs for prevention. The first is where you can take a tablet by mouth orally, and this is usually done by uninfected individuals. And if taken daily, in this instance, tenofovir plus emtricitabine packaged as Truvada, there we have a number of studies showing compelling evidence, up to 75% reduction in HIV transmission. Then say if you had one half of the couple. One was positive, one is negative. If the positive individual went on treatment, now, usually treatment initiation is done in Africa, for example, or developing countries with CD4 counts less than 350. In the US, if you can afford it, you can start treatment at any time, but the sort of cutoff is about 350. But if you disregard the CD4 counts, and if somebody was positive, you initiated them on treatment, then you can have 96% reduction of transmission to the uninfected individual. That's close to a perfect vaccine. The big gap is in adolescent women, and in sub-Saharan Africa, and particularly in southern Africa, in a rural community just about an hour and a half west of Durban, where I've done quite a lot of research. By age 20, 1 in 3 women are already infected with HIV. By age 24, it can be like 1 in 2. So these are incredibly high burden areas, and a lot of our studies are done including women 18 and above. The key driver of risk in this setting is young women having sex with older men. Now, I'm not talking about men who are 50 and 60 years old. I'm talking about men in their 20s. So just a 4 to 5 year difference, and the risk of getting HIV is substantially altered. Now, for an 18-year-old with a 24-year-old partner, it's really a challenge to negotiate condom use. But as long as there's this difference of young women getting infected in their late teens and young men acquiring infection in their 20s, we won't be able to see the end of the epidemic in Southern Africa. And there is one of the gaps, and I'm hoping that we will be able to have registration of Truvada, and we will have other studies confirming the Caprisa 04 trials, because methods that the women can initiate will be an important piece in our quest to end the epidemic.
And Dr. Karim mentioned a CD4 count. CD4 cells are a type of white blood cells that fights infection. The CD4 count measures the number of CD4 cells in a sample of blood. Along with other tests, the CD4 count helps to gauge the strength of the immune system by indicating what stage the HIV disease has reached. It also guides treatment and predicts how the disease may progress. Experts say keeping the CD4 count high can reduce complications of HIV and extend a patient's life. Well, tomorrow we'll have part 2 of our interview with Professor Quarrisha Abdool Karim. That's our Africa Health Network for today. For more health news and developments, be sure to visit our website at africahealthnetwork.com.